Hey, what's up? I'm Edan Harr, CTO of AICD-10.
And I'm David Hubbell, CEO of AICD-10.
And today we're going to be answering some of our most commonly asked questions. So, David, give us your elevator pitch.
Elevator pitch. AICD-10, it's one-click billing for the medical industry. So healthcare reimbursements still rely on fragmented documentation, like manual chart reviews and shrinking workforce of experienced coders. AICD-10, we're building an AI-native reimbursement platform that structures the patient journey and produces explainable and audit-ready coding recommendations.
Yeah, so our goal is to increase reimbursement, reduce denials, preserve institutional knowledge, and dramatically reduce administrative burden.
We also get asked, where did the idea come from?
Yeah, that's a good one. So the idea didn't start in healthcare. David and I actually spent nearly 2 years building a proprietary data ingestion engine that converts fragmented information into structured workflows. And we successfully applied it to retail operations, inventory management, workforce scheduling, and our own businesses.
Yeah, the healthcare opportunity emerged after conversations with heart surgeons. They were describing all the efforts required to restructure the patient encounters for reimbursement.
Yeah, so before writing healthcare-specific code, we validated the concept with, physicians, coders, billers, practice owners, and healthcare executives, and then refined the prototypes through direct clinical feedback.
Yeah, we pivoted into healthcare. We just realized that the technology we built solved a much bigger problem.
Yeah, healthcare data is highly fragmented with physician notes, PDFs, imaging, lab results, referrals, and EHR exports spread across disconnected systems.
Yeah, the reimbursements depend on manual piecing that information together. We believe that our ingestion engine could eliminate much of that work.
That's right. So why now?
Why now? That's a good question. So we feel like three trends are happening right now in this moment. Documentation requirements grow.
While reimbursement becomes more complex. So where one code used to map to one diagnosis, now it might map to 3 or 4.
Yeah, there's experienced coders that are retiring. That's taking decades of institutional knowledge with them. And AI is finally capable of reasoning over the healthcare data, provide that data as a first structured to organizations.
Yeah, it's got to be structured and organized first. So why is this problem important?
Well, administration overhead costs healthcare's billions every year.
Yeah, providers spend enormous time reconstructing patient histories instead of focusing on care. And delays, denials, inconsistent documentation, staffing shortages, and lost institutional knowledge only make the problem worse.
So we believe that the reimbursement needs to be an intelligent infrastructure layer. It's not just another coding tool.
Mm-mm. So would you say that customers recognize the problem?
Yeah, absolutely. Customers would love to know what their bill is in real time.
Yeah, we never have to convince people the problem exists. Physicians, coding managers, billers, even patients immediately recognize fragmented documentation, staffing shortages, reimbursement leakage, and operational complexity because they have to deal with them every day.
Yeah. The best question we get is, how did we meet?
That's right.
So I own a candy store. My wife and I own a candy store, and Edan serves as a director of operations. Together, we started building and solving operational problems within our own business using AI automations in almost every operation that we do within the candy store. We started taking that out into the community and helping other small businesses restructure using AI as well.
That's right. So you own a candy store, I work in AI. Why are we the right team to solve this problem?
Well, I believe our backgrounds complement each other.
Yes, so I spent 2 years at Intel as a lead data analyst and AI consultant, building enterprise analytics systems, supporting billions of dollars in transactions and hundreds of global agents.
And I have about 2 decades of operational leadership and business development. I've built and exited from many companies. I've managed over 600 properties, 60 agents, and participated in multi-million-dollar transactions.
Yeah. And then together we've spent almost 2 years building production AI systems and validating them with real customers. So outside of us, who else is involved?
So one of our medical directors is actually a heart surgeon. He's owns a private practice, and he's been helping shape the product and the roadmap and validating clinical workflows.
Yeah.
So we also collaborate with the physicians, coding managers, billers, healthcare executives, specialty providers to ensure that the platform reflects real-world reimbursement needs. Well, Why do you think we're going to succeed?
Well, we're solving the problem at the infrastructure layer. So while many companies generate codes after documentation is complete, we're focused on continuously structuring the patient journey and creating an explainable foundation for reimbursement. Customer conversations consistently reinforce that this underlying data problem remains unsolved.
Yeah, but the big picture is, how big is the market?
Yeah, so we view the opportunity in 3 layers. Our initial focus is specialty practices and design partners where we can quickly demonstrate ROI. Our serviceable market includes roughly 196,000 U.S. medical coders, and at approximately 300 per seat off of our projections per month, that represents over a $700 million annual software opportunity.
Cha-ching.
And then long term, we see expansion into hospitals, physician groups to improve reimbursement and patient financial transparency, creating a multi-billion-dollar opportunity.
Yeah, in our long-term vision, we don't believe coding is the destination. So coding is simply the first application built on a much larger data platform. Our vision is to become the operating systems for clinical reimbursement organizations. Fragmented healthcare information, turn it into structured intelligence. It powers the coding. Documentation improvement, denial prevention, compliance, analytics, patient transparency, and the future AI native workflows.
Yeah, so when we succeed, providers will spend less time reconstructing patient encounters and more time delivering care, while reimbursement becomes faster, more explainable, and less dependent on manual administrative work.
Thank you for tuning in, and hope you enjoy our journey.